Good morning, Commissioners and Chairman Rowe. My name is Dr. Mark Robinson. I'm a physician in Houston and Harris County. In my practice, I routinely care for incarcerated patients, mainly those who require hospitalization. I'm here representing my own opinions, not those of my employer or the hospital system in which I work. I submitted several rule comments and suggestions, and I greatly appreciate you allowing the forum for comments to be made. My public comments suggest changes with regard to HIV care, chronic medications, shackling in hospitals, and continuity of care on discharge, but today I'm specifically going to talk about my comment regarding family contact while a patient from jail is hospitalized. I know this body has the unenviable task of taking comments, recommendations, suggestions, best practices, and creating rules and regulations to facilities of all sizes and resource allocation. That said, I believe that whenever a patient is hospitalized with a serious illness, it serves everyone, the jail, the family, the patient, and the hospital, to keep the next of kin in loop and updated regarding medical care. As it stands now, most hospitals defer to the jail facility when to contact next of kin, and typically contact is only allowed when a patient lacks decision-making capacity and there's a decision to be made, or a patient is gravely ill. Obviously, these are crucial times, but it leaves out the many other times when contacting the family is incredibly important. When a patient is sick and things could take a turn for the worse, when a patient is undergoing anesthesia or surgery, when a patient has capacity to make decisions, but needs help making a really tough medical decision. Talking and discussing with loved ones during an acute illness is core to the delicate relationship we must build in the hospital. I remember a case where a jail patient was hospitalized for weeks and didn't have any of the criteria to allow family contact. Then they took a turn for the worse and the family was contacted. It was devastating for them to hear about the hospital course, and the medical team felt complicit in causing their pain. If we only allowed contact when patients are on death's door or after a procedural complication for a procedure the family didn't even know was happening, it'll be impossible to build trust with families. I lead a section of over 70 physicians and have trained hundreds of doctors in training. Not being able to update a family is the most common frustration I hear about taking care of jail patients. There's ample evidence that involving and updating families in care reduces the risk of lawsuits and improves emotional well-being for families, patients, and the staff. It's substandard practice to do anything else. My suggestion is that family contact should be allowed and required for patients admitted to the intensive care unit, those hospitalized more than 7 days, or those undergoing a procedure requiring anesthesia, and especially those experiencing end-of-life care. I understand the security risks. Hospitals with non-secure units are vulnerable, and the last thing you want is a family without permission to visit coming to the hospital. Often the next of kin is a victim, but these problems are not insurmountable. Jails and hospitals can have a medical liaison who's trained in contacting families and minimizing risks. Physicians can collaborate with the jail on who's best to contact and call on a secure and reported line. There are myriad solutions. I ask that you consider implementing common sense rules which would benefit patients, healthcare workers, jails, and hospitals. I really appreciate your time and happy to help in any way.